Have you ever witnessed or experienced some kind of terrifying event? How do you feel after experiencing that? Are you feeling scared, feeling anxious, or even feeling terrified? If yes, then it might be a trauma. A trauma is a condition where your body responded to a disturbing or distressing event that you have encountered before in the past. For one example from someone I really know, it is my sister. She felt anxious, having insomnia because of nightmares, and felt restless for weeks after and even when my father died. For other example, I believe most of us here already know is when one or more military troops came home from a war, they might feel terrified or having some nightmares where they were recovering from their injuries or post-war activity. But today, I won't talk about trauma. I want to talk about PTSD or post-traumatic stress disorder. First of all, you may be asking inside your head, what exactly PTSD is? What is the difference between trauma and PTSD? I myself here am not an expert, but I will try to explain to you according to my own shallow knowledge. The main difference between the two issues is the length of symptoms. Following a traumatic event, a person might feel anxious, fearful, or having a bad dream. It is, of course, a normal reaction to a traumatic event. The symptoms will decrease and gradually disappear from time to time, and you can continue your normal life. That is what we call trauma. In the case of PTSD though, it is different. The symptoms won't decrease that easily, or maybe it will decrease in a very long time, and the people who felt it will feel worse and worse every single day. PTSD and trauma may look the same, but it is different. When someone experiences a trauma, it may disappear after a few weeks and the people can continue their life normally. But in PTSD, it may last for months or even years of anxious, afraid, and restless. It can trigger with bringing back memories of that traumatic event. One question is, what kind of events that can cause the symptoms on a person? It actually depends on what the person is experiencing or witnessing. It can be a vehicle-related accident, a war, a physical or sexual assault, natural disasters, having someone important to them gone, or any kind of events that might damaging or hurting them physically or emotionally. But not everyone with PTSD have experienced or witnessed that even themselves. It is still possible to develop PTSD after witnessing someone else. Every symptoms I have mentioned before is just some simple symptoms. Is there any other symptoms? The answer is yes. other than bad dreams or so we call nightmares. A person might experience insomnia and felt restless for weeks or even months. There are similar symptoms, for example, in their behavior. The person might isolate themselves or feeling hostile to other people, and in the possible worst case, they might hurt themselves. And the next is psychological symptoms. They might having flashbacks to a certain traumatic event, feeling afraid, having severe anxiety about that events might happen again in the future. Unfortunately, PTSD can also happen with children. How is it? You might feel that children can't have severe anxiety like adults can, but they can. I know that you may be feeling sorry for them because they started feeling anxiety in such age. It is something we must know and prevent before they are growing up. Children can feel extreme fear of getting separated from their parents or having nightmares. As I said before, it may doesn't look too bad, but it is really, really bad. PTSD won't decrease as fast and as simple like trauma, but of course they won't last forever. It will really end sometime in the future, even without some professional treatments from the expert, but after a very, very long time. But of course, there are some professional treatments for PTSD. A person can receive psychological therapy from experts like psychiatrists. The therapy including using a talk therapy, eye movement therapy, or exposing a certain traumatic event, in this case, of course, in safety ways. Or else a person can receive medical treatment using SSRIs with clinical psychologists. Before you want to receive any professional treatments I have mentioned, you may want to try to calm down first and imagine how would your life goes when you have calmed down in the future, and how nice it would be without feeling afraid and anxiety about what already happened in the past. Of course, it is not the best way to make your anxiety and fear disappear. As I said before, I am not an expert myself. So, if you don't feel any differences or you're feeling that your anxiety is still there inside you, you may want, or either, I highly recommend you to meet an expert, a psychiatrist or a clinical psychologist. When you happen to know someone with PTSD symptoms, don't just be quiet, talk to them. You may want to recommend them to go see the expert to receive some treatments to decrease the symptoms they have experienced. That's all I want to say. I certainly hope no one of us will experience trauma or even PTSD. My name is Muhammad Iqbal Fajri. Thank you for coming and listening to my speech. I wish you all the best in the future.